Well, let's get into this a little bit with the vaccination rates and what we're seeing with the demand and supply. I was one of those people early on checking the computer every day, couldn't get an appointment. Johnson & Johnson looked like the wonder shot, it's the one shot wonder. And then all of a sudden, things started changing around the vaccine and the perception of it because of some issues that came up. Can you talk us a little bit about why they were pulling it off the market? It looks like it's going to be back on. They're reinstating it. What should people know about J&J?
Sure. So it's a little bit different type of virus than the other two that we're familiar with, Moderna and Pfizer. Moderna and Pfizer are mRNA vaccines. It's the first time we've ever had an mRNA vaccine that's been used. We have been working on it for about 20 years. There has not been much uptake because developing vaccines is very expensive. And the ones they were working on, which they already have a vaccine, but it's not fully approved because they're going through trials, is Zika, rabies, CMV. These are diseases that not many people get. You don't hear much about Zika and Ebola. And so to get the numbers of individuals in a trial just to say, yes, it's safe or not safe, it takes decades. So when people say this one was rushed, it really wasn't. It was in what people are saying. It's rushed because we put in a lot of resources in it. We told the pharmaceutical companies, don't worry about your losses, we're going to cover you. So those obstacles went away. And we had more people saying, me, I want to get a vaccine as soon as possible, even if it means getting into a trial. And then it was worldwide. So you had how many millions of people who are being affected. And so we had numbers really, really quick. So we could go through the different phases of the trial very quickly, but it wasn't pushed through and rushed. It just, everything's condensed because of resources and number of people. So mRNA is very successful. The J&J, what they do is they take a virus that doesn't really harm us and they attenuate it so it can't really reproduce. And they put the viral particle, the mRNA, the virus inside this other virus, and the virus gets into us and our body fights off that virus. In doing so, it also develops immunity towards COVID. They all are very safe. And let me talk about that because you probably may be saying, Kevin, I have heard about these blood clots. And yes, there have been 6, 8, 10, whatever number there are blood clots in over 75 million people. That is 1 in a million-ish. The rate of getting a blood clot, if you receive the J&J vaccine, is 0.0001%. That's a lot of zeros of a percentage. The rate, if you're on birth control pill of getting a blood clot, is 0.1. It's about 1,000 times greater. The rate of getting a blood clot if you smoke is 0.2, 2,000 times greater. The rate of getting blood clot if you get COVID is 16.5%. So you can get the vaccine and go through a 1 in a million chance of getting a blood clot, or you cannot get the vaccine. If you get COVID, your chance of getting blood clot is 165,000 times that as getting the J&J vaccine. That chance actually is even less than that of some of the complications with flu vaccine or most other vaccines. So there is remarkably safe. Unfortunately, there's a lot of attention, people in tune to COVID, and a lot of people on the fence because it's new and wasn't rushed, which, as I said, it wasn't really rushed, that the media has really grabbed hold of it. And unfortunately, people who are wavering are now maybe wavering more not to get the vaccine.
And that tends to be a big problem, but this really does speak to the quality and the care going into the clinical research too, though. They're saying, hey, there's a few people, we're seeing some issues. Let's take a step back. Let's look into this. And if things are looking good, we can reintroduce it. That's pretty standard operating procedure, and nothing that the general public should be necessarily worried about. But with the headline grabbing virus that we've all lived with for the past year, it certainly does change perceptions. And you are starting to see a potential impact in people's willingness to get vaccinated then in turn. Is that a fair statement?
Yes.
Okay.
So in the medical community, so the public, people saying, oh my gosh, we have these 6 clots. Medical community, we're saying, wow, 675 million. How did we detect that small change? Historically, we never would have detected 6 out of 75 million. But our detection system is now so good at picking things up. The medical community, like, this is fantastic, because we know there's going to be complications with absolutely anything. You could take aspirin and get allergic reaction, take aspirin and get stomach ulcers. Those occur much greater frequency than there was any complications with the vaccine, with the exception of like a sore arm and feeling fatigue. Yes, that's fairly common, but the real ones that we're concerned about.
So bottom line, let's say Pfizer runs out, all these other shots are no longer available. J&J is the only one. What would you tell your friends and family?
Get it. Absolutely get it. The only one, if someone is a smoker and on birth control pills and has a history of blood clotting because of some genetic predisposition, which there are several different genes that you have predisposition, not common, then I'll say, yeah, maybe think twice. Because first of all, if you have a predisposition and you're on birth control and you're smoking anyways, you have a pretty elevated chance. Why just add a little bit more on? I would say get it and stop smoking.
Excellent advice there too as well. So let's switch gears a little bit. This has been a big news week in terms of just changes. Yesterday, new guidance on wearing masks out in public. Walk us through what we need to know now going into summertime as people are getting out. They're eager to get back out in the sunshine and in the warmth. Masks and crowds. What do we need to know now?
Yeah, so really the only reason why there's a change is because more people are vaccinated. Right? Around here, it's 40%, 1 out of 5. So it makes a difference. 2 out of 5. It makes a difference when more people are vaccinated. You start to get, you don't have herd immunity, but you start to get closer to it. The reason why they started changing it is because more people vaccinated. The outdoors, that's where they're focusing first. When you contract any virus or bacteria or amoeba, whatever it may be, it depends on the viral load. That means how many of those viruses are on you, and then also your own immune system. But I can have 10 different COVID viruses on me. Chance of me actually getting COVID is very, very low. Now, each virus has a certain number that you need, average, to get infected, whether it be COVID, the flu, HIV, hepatitis C, whatever it is. And so you still need a certain amount to get on you, then you get infected. If you're outdoors, with the breezes going everywhere, the chance of you actually taking on a big load of virus, if you're talking 3, 4, 6, or 8 feet away from someone, is less than that if you're in a closed room. And so being outside, that's why that's the best place you can be, just by sheer circulation.
So let's say people have tickets to the big concert at Riverbend. They're going to be packed in there. You've gotten the vaccine. Are you wearing the mask or are you not wearing the mask?
That's a great question. Something that people don't have answers to. Now, let me tell you my opinion. This is the opinion of Kevin Joseph. I'm vaccinated. I feel comfortable at this point in time because the vaccine covers the variants. In a month, it may not. So this is me, okay? This is my comfort level. The vaccine is very effective, and I believe it'll work. Now, will the venue say, hey, if you've been vaccinated, feel free not to wear a mask? Absolutely not. So how are you going to know who's been vaccinated, who's not? So when the government comes out with opinions, they're always going to say, what about the masses and how we govern all this? Because if you make a rule, then you don't know who's going to have the vaccine or not. So that's why I'm saying my opinion, I would feel safe if I've been vaccinated being in that setting at this point in time.
Very good. Well, as a reminder to our audience, if you have questions, use that chat feature as we talk through things. Something might trigger in your mind. I want to get more information on that. Use that chat feature and we'll get around to that. Another big topic is disinfecting surfaces. Back a year ago, I think that run on Lysol wipes and wiping everything down, and I was taking the pocket hand gel to wipe. Go to the grocery store, you're shopping. I'm like, oh my gosh, before I touch my car, I've got to disinfect, wipe everything down. Now we're starting to see, while disinfecting is certainly important in cleaning, in terms of COVID-19 prevention, is it the surface disinfection? Is it the mask? And certainly, obviously, the vaccination is important, but where are we now on those Lysol wipes? Or does Lysol need to be worried about their stock prices now?
Yes, exactly. Should have bought in February and sold last month. So we've known this for a while. COVID does not live well on a piece of material. So say I have a menu and I have COVID and I put 1,000 germs on it. Over time, those germs are going to die and die quicker than say if they're just floating in the air. But then another person has to grab it and have enough on that they're going to then put onto their hand to then put up to their nose or mouth or eyes to then get the vaccine to be infected. So there's a couple of ifs. So at each if, the chances obviously the probability goes down. A lot of physicians say that one of the benefits of wearing a mask is you don't touch your nose and you don't touch your mouth. Benefits of wearing goggles and glasses, you're also not touching your eyes. So therefore, if you do happen to touch this contaminated surface, then the chance of you actually giving it to yourself is less. And so wearing a mask, if you have glasses and you just keep overall clean, I go out to restaurants and I don't really worry about the menu, but generally I use alcohol before I eat anyways, or say hand sanitizer before I eat.
So keep the respiratory droplets away, but surfaces, maybe a little bit more leniency there, it sounds like.
Yes.
All right, so we're getting to some questions in the chat, and it did mirror some questions that we got submitted ahead of time, is people who have had COVID-19. We're hearing there's maybe a 90-day waiting period to wait before getting vaccinated if you've been diagnosed with it. And there's also that thought of, if I've been through it and run the course of it, do I still need to be vaccinated? So what's that look like for the people who have been diagnosed and made through COVID-19?
Sure. So the reason why we said wait 90 days before, when the vaccines first came out, said if you have had COVID-19 last 90 days, don't get the vaccine. That is because we didn't have much vaccine. And at that time, if you had COVID-19 within the last 90 days, we think it's even more, 8 months, 9 months, you're not going to get infected. Remember, at that time. So take that vaccine and give it to someone else, right? If you've been in that 90-day period. It didn't have anything to do with you having COVID in the vaccine. So at this point in time, we've got plenty of vaccines. You don't have to wait the 90 days. I just wait 2 weeks. The time you have to wait 90 days is if you received certain treatment for COVID-19. It's convalescent plasma or one of the monoclonal antibody treatments. Then you have to wait 90 days. Haven't received those, wait 2 weeks. Now, remember at that time, if you get infected now, you still want to get the vaccine because, or if you've been infected back then, you still want to get the vaccine. The reason why is if you have had the normal, the native or the original, let's call it the original COVID-19, and even if you have antibodies towards the original COVID-19, those don't work well against the variants. And in this area of the country, 65% of COVID-19 is a variant right now. So you have a better chance of catching a variant, for which the natural immunity does not work. So, but the vaccine does. So there's another reason why to get the vaccine, even if you've been infected. Your antibodies are, one, going to wane, and two, they're not effective against the new variants.
We just got a question in the chat, which I think you answered, from Carlos about being diagnosed. He received the plasma treatment. So that 90 days sounds like a good waiting recommendation. And then once you're vaccinated, how long is that vaccine good for?
Sure.
Do we know?
once you've had COVID-19, you only have to wait 2 weeks. Okay. So the 90 days was really to preserve vaccines before. I'm sorry, what was that question?
Well, there was a mention that he got the plasma treatment. So is that a consideration then?
Oh, yes. If you receive the plasma treatment, then you have to wait 90 days.
And then now the other big question is, do we need a booster shot? How long is that vaccine good for? Are we going to have this annually like a flu shot now?
Yeah. So if I answer this and I'm accurate, then play lottery or something, because no one really knows. This is a crystal ball question. There is, just from the base of science and how these vaccines are created in history, particularly mRNA vaccine, people are thinking that it's going to be a while before we may need a booster. Certain vaccines, you never need a booster, right? Tetanus, they say, 10 years or 5 years if it's a very deep infected wound. A measles, mumps, rubella, you really don't necessarily need a booster your whole life. Flu, because it mutates, you need a different shot each year. We don't really know about this. One, because we don't know how long the immunity is going to last after a vaccine, but we think it's going to be a while. We just don't know. Could be forever. And two, if there's variants. Right now, the vaccine works with all the variants. Who knows what's going to be in 6 months? And there may be a new variant that a vaccine doesn't work against, which case you need a booster, similar to how the flu changes and modifies.
So we have more questions coming in on chat. I do want to get to some of the questions that were submitted by our registrants, specific to people living with developmental disabilities. There's a different set of concerns with masking. Some folks may have a sensory reaction to wearing a mask. Others may have an allergy, and they are concerned about getting the vaccination because of past issues with flu vaccines. So some of the same questions that you get screened for are on that questionnaire. So for somebody who's eager to get back into programming, they may have a sensory issue with masking and they're worried about the vaccine or they're hesitant. What does that community integration look like for somebody like that? And being around peers, is it a risk? Is it a concern?
Yeah, the concern is obviously much greater. The more barriers you have to being infected, the better. The barriers include a mask. Barrier, very strong one, is the vaccine, because the barrier is actually then is your immune system. Barrier of distance, barrier of being outside, because then you have more air and movement. So the virus is diluted if you're near someone who's been infected. If someone does have sensory challenges and they also don't want to get the vaccine, then they are at higher risk. The risk goes down as more people in the community become vaccinated, right? So your chance of me coming into contact with someone, and that's where herd immunity really is beneficial. Herd immunity is almost, to a certain extent, is a service to others in the community, to make sure that we can everyone live their life. Some religious organizations say that it's selfish not getting a vaccine, and it's a service to society to get vaccine, a service to others. Because that's really what we're trying to do, is reach herd immunity so that everyone can live the life they want to lead.
And a lot of people that we serve who have developmental disabilities, they rely on public transportation. They're still going to be in those small spaces. Mm-hmm. Vaccinated or not vaccinated, is it still good practice to wear the mask?
Absolutely.
Long term?
Oh, vaccinated or vaccinated?
Yeah.
If you're unvaccinated, absolutely. You're in a especially confined space, public transportation, yes, absolutely wear a mask. Try still as much as you can stay away from people. Wash your hands after you leave the location. If you've been vaccinated, it is less of an issue. Now, I think partly in your question, unless I just read into it, was if you've been vaccinated, are you a carrier? So let me go through what happens when you're in contact. So I've been vaccinated. If I get in contact with someone who has COVID-19, can they give me the virus? Yes. Am I going to get sick or infected from the virus? Probably not, because I've been vaccinated. So I will, for a little while, have some virus on me. It's not going to be spreading because my immune system is going to be attacking it as soon as it starts to multiply, and it will start attacking it even before it multiplies. So over time, say 1,000 viruses jump onto me. Over the next period of time, I don't know, could be 5 minutes, could be 5 hours, could be 5 days, those are going to be going away. Can I then give those to someone else? Yes. But am I going to give enough of those 1,000 virus to someone else that they're now going to get infected? So maybe I'll give off 20%, 200 of them. Chances are that's not going to get that person infected. So can I technically carry it? Yes. Is a chance of me spreading it in making someone else infected going to happen? It's pretty low, very low. And the same rationale goes for flu. It goes for any other disease process. Could be MRSA that we all have heard about. It could be carrier. Chance of us spreading it is much lower if we've been vaccinated.
So for folks who may be on other medications, we talked about J&J and the clot risk, and there's some other risk factors that hint at clotting, but even looking beyond that, if somebody's on a regular medication that they use to control a symptom or control a health condition outside of COVID-19, are there any risk factors with getting vaccinated with any medication that somebody may be taking regularly that they should be aware of?
It's really not common to have certain medications that increase your chance of clotting. If you're on a bunch of medications, I would still contact your physician. The main risks for developing clotting is genetic predisposition, smoking, birth control pills, sitting still, cancer, and then surgery. All those in different ways and mechanisms do increase your chance of clotting. So, and it's just we combine. The more you combine, like smoking and birth control at the same time, your chance goes up. But in any case, your chance going up is much greater with anything I just stated than it is getting the J&J vaccine by thousands fold.
So a question in the chat, there's been a lot of research and opinion on whether the antibodies can be passed from a vaccinated mother onto an unborn child or through breastfeeding. What do you see in there in terms of mother to baby transmission of immunity, and what are we doing with the younger kids? Are they getting vaccinated? I don't think right now it looks like 16 and up is the vaccine threshold.
Yeah, so great questions. Still a lot of information to gather with pregnant women and nursing women, because one, if you were pregnant during the trials, you weren't allowed into the trial. Now, there were hundreds of people, women obviously, who were either pregnant but too early when they got the pregnancy test, when they got the first vaccine in trial, or they got pregnant between the shots 1 and 2 during the trial. And all those moms are doing well. All the babies are doing very well. The American College of OBGYN, American Society of Reproductive Medicine all say get the vaccine. So everyone is thinking it's very safe for both mom and baby. Do the actual antibodies transfer? Starting to be some evidence saying, yeah, maybe it does, but there's not many moms who have gotten the vaccine while being pregnant, and then we know if the antibodies transfer, right? Because really, we started giving out the vaccine in December, and so if you're pregnant at that point and you got the vaccine, it's still going to be months before you even start to breastfeed. And then really, then we need to start collecting data. So we don't know that information about antibodies crossing over. Gosh, there's another good part of that question that you asked.
The kids, they're going back to school up to 16. What's the research looking like on whether children should be vaccinated?
So Pfizer is 16 and older. Moderna is 18 and older. Pfizer has been doing research. Actually, both have been doing research, younger ages. Pfizer has submitted for an EUA, emergency use authorization, for ages 12 through 15. That's the same process they went through for Moderna and Pfizer of getting 16 to 18-year-olds over. It's called EUA. And they submitted for 12 to 15 several weeks ago. I personally am hoping that they approve it very, very soon, because if they get approved, the day they get approved, the next day my children are getting it. And they're 12 and 14.
That's a pretty good endorsement for vaccination, I think, right there. So, talk about, for folks who haven't been vaccinated, maybe did contract the virus. We do hear a lot about long-term health impacts for people who have survived the virus. What should people be watching for in terms of long-term complications? I mean, I know we've only been dealing with it for a short period of time in terms of clinical awareness, but there's some evidence coming out that there are some potential long-term impacts and disabling outcomes of infection.
Absolutely. So this virus is very, very bizarre in many ways. One, when you get the virus, it presents itself in so many ways and so varied. You can have elderly people who do perfectly fine, and you have 20-year-olds that we see that are dying. You have long-term complications and people who are very, very healthy, and not with those people who are not healthy. It's just, and who would have figured that this virus would, yes, cause clots and affect your lungs and your heart. And by the way, you can't taste or smell, and you also, it's bizarre. It gives you brain fog, and none of it really is, it's no constellation of, yep, if you have this, this, and this, then you probably have it. It is all over the map. Same thing with the long-term effects. They're all over the map. Some people don't have any. Some people have chronic shortness of breath. Some people have chronic fatigue where they need to sleep an extra 4 or 6 hours a day, or they just never really get that oomph in their step. Brain fog is a very big one. I talked about it earlier today with someone else about there's people who don't drive because they are on the road and they know they're slow to react. Is at a red light. Okay, what do we do at a red light? Okay, stop sign. Okay, I'm looking around, but they're not sure, really comfortable about, okay, I feel like I'm safe to go. That is very severe. There's a lot of research being done on this across the country. There are still people who had COVID-19 months ago and they still have these symptoms. We don't know how long they have the potential to last. I think this is as scary as getting COVID itself, the long-term effects. Now, what I will say is not only doing a lot of research about this, and now there's therapy clinics for this, brain fog clinics and lung clinics and cardiac clinics and fatigue clinics for fatigue, kind of rehab clinics. And TriHealth has 2 of them, trying to help out post-COVID long haulers, we call them. But there's evidence that the vaccine will actually help out these long haulers and make the symptoms, diminish the symptoms to a certain extent. So another reason, if you've gotten COVID, to get a vaccine is it may help out the long haul symptoms.
Very good. A couple more questions coming in through the chat. What if you are a carrier of hemophilia? You are not affected with it. You're a carrier of hemophilia. Can that cause you to get blood clots?
So my personal opinion is no. I would absolutely talk to your hematologist. They know much more than I do about hemophilia, okay, and different unusual maybe complications, or if you're carrier versus actually have the full trait. But clinically, it doesn't make sense on the why. So I would just give them a call, your hematologist.
And getting back to a question about younger children, do you think the vaccine will eventually be available to young children ages 2, 3, that toddler age in the future?
Yep, Pfizer started a study in younger. I believe it's down to 6 months, and it's probably about 3 weeks ago they vaccinated the first kind of toddler. I think it was at Stanford in California, and they're 2 years old. So studies are starting with the very young age group.
So here's an interesting one that just came in. If you received the J&J vaccine the first time, and you do require a booster, and this might be applying to Pfizer or Moderna as well, are you going to be required to take that same type or brand of vaccine if a booster is recommended? Is there a correlation to now keeping that card documented saying, okay, I'm a Pfizer vaccine person, so I need that Pfizer booster?
That's a great question. So here's the current thought process around this. The mRNA vaccines are so much alike. They just have some different preservatives in them, which require them to be stored at different temperatures. require them to be injected into someone in a certain amount of time period. No one can really answer that question of, well, does it work going if you use Pfizer and Moderna and the Pfizer? And we can't answer that question because we've never done research on it. So no one can say yes or no. However, 99% of scientists say it shouldn't make a difference. But no one can recommend it, right? But it shouldn't make a difference. What the government has come out with is, if you've gotten Moderna and someone makes an accident and then you get Pfizer, don't worry about it. Not a big deal. And everyone feels very comfortable saying that. We just can't recommend it. So going forward, will they maybe recommend make sure you get the same type? Yeah. Will it make a difference? Probably not, because it's so similar.
So as we do kind of get back into reopening, this ties into some of the questions that people submitted in terms of sizes of activities, from maybe a classroom to a concert hall. Do you foresee that there will be a need to limit capacities still? You know, we're looking at Crone Conservatories announcing that they're going to be reopening soon, but they're going to be doing a time on demand. You've got to schedule your visit to visit the butterflies this summer. Is that kind of how things are shaping up right now as we reopen?
Yeah, I think in the meantime, there's going to be limitations. Still going to be restrictions. You have to wear a mask. If you fly in an airplane nowadays, they now specifically say, even if you have been vaccinated, you still have to wear your mask. Otherwise, you'd be kicked off the airplane and all that kind of other stuff. Because part of it is we don't know who's been vaccinated and who hasn't. Part of the government is looking after the population. So when you look at the population, they're going to also require different industries to, you know, there's OSHA and there's different, there's Food and Drug Administration, there's healthcare boards that require X, Y, and Z. And some require a certain number of people in a certain setting, like fire codes. We all know you only allow a certain number of people in a certain size room. Well, this is just a different type of code that it's not really written, but it's suggested, and the companies are following that. What happens long-term, I don't know. So what happens if we don't reach herd immunity? Are we all going to be required to wear masks forever? Maybe. This is going to be a political kind of argument one way or the other. And does anyone have a right to force anyone? Then also, at the end of the day, even if there isn't herd immunity, what's the government going to decide? Are they going to say, nope, everyone still has to wear a mask? Or, you know what, we can't have, 60% of the population have consequences for what 40% of the population don't want to go with. And I don't know where this is going to fall out on that spectrum. So will Crone always have to have a limited capacity and everyone wear a mask? Or is at some point in a year or two or three, we say, listen, enough's enough? Your guess is as good as mine.
And just clinically speaking, in terms of mask wearing, taking COVID out of it, what did you guys see in terms of flu this year? I was hearing like the flu. What's the flu? Like, didn't even see it this year. Is that? Do you see a correlation with masking and other infectious diseases?
90% less flu. So out of all the cases we normally have, we only saw 10%. So absolutely, it made a big difference. People were still wearing masks, staying away from each other, washing their hands. It's the same things you want to do to prevent the flu.
Question getting back to COVID-19 and infection. There were a lot of different treatments and therapies, different experimental cocktails, if you will, of medications. There was I think there was the remdesivir. I'm probably going to butcher the name of that pronunciation of that. Where are we in terms of actually treating somebody who is infected? Is there progress? Are certain things working better than others?
Yeah, so convalescent plasma does not work as well as what we thought. The remdesivir and the other ones, which by the way, I'm convinced when pharmaceuticals name these drugs, they all get in a room and they take a Scrabble board and flip them upside down and put them together, because none of them are easy to pronounce. Pharmacists are probably great at Scrabble, and we can't prove them wrong. So anyways, yes, very complicated named drugs. Those ones that are called monoclonal antibodies, the remdesivir, they are effective. mildly to moderate. Is more evidence saying, maybe not as effective as we thought they were. That is, by the way, monoclonal antibodies are the ones you have to wait 3 months after you receive that to get the vaccine. Things that really make a huge difference are steroids. It makes a very large difference. If you made it to the hospital critically ill, we flip you every couple of days. You're on the stomach and then your back, stomach and the back. And that helps out a lot for different reasons associated with your lungs. We give low-grade anticoagulants to make sure you don't have that clot. Because remember, 16.5% of everyone with COVID who are hospitalized end up by getting a clot. Those are the main ones, really. Steroids, trying not to intubate people, intubation and putting on a ventilator. It's good, it can save lives, but no matter what, it causes harm to people's lungs. And even the small amount of harm, apparently COVID really takes advantage of. So we try and do everything except for ventilate individuals. You mentioned the flu vaccine, and I do want to put something in perspective. Flu vaccine on average is about 35 to 50% effective. So not that effective. The vaccines for J&J, I believe, is about 75%, and that of Moderna and Pfizer is 95% effective. So 2 or 3 times as effective. And by the way, COVID-19 is 6 to 7 times more deadly. So people get a flu vaccine for something that isn't nearly as effective and not nearly as deadly, but they won't get the COVID vaccine for something that is much more effective and the virus is much more deadly. It's something to think about.
And putting that in perspective further, there still may be a risk that if you get the vaccine, you may still become infected and make it sick or feel sluggish, but you're not going to die. I mean, that's a huge, it's a modern medical breakthrough, really, to say that this vaccine that is born on the research, decades of research, and people have that perception that it was, rushed to market, but it is based on some substantial research, 100% almost that you're not going to die if you get this vaccine from the disease. I mean, that's pretty incredible.
It is very impressive. And another issue that media, I think, notified the community, but I think kind of made this community a little bit more nervous, is, my gosh, we've had 5,800 breakthrough cases. People got the vaccine and then they got COVID. Well, we know that the best vaccine is in COVID, which is far better than anything else, is 95%. Right? So you say, okay, get the vaccine, there's 5% chance I may get sick. Well, the 5,800 individuals that we know got COVID after being vaccinated, out of 75 million, that is 0.00008% chance. I mean, there's this, play the lottery if you actually get sick after getting the vaccine.
Yeah, the statisticians are taking note of those odds. So that's pretty impressive. So another question as we kind of near the end of our hour here. There's thoughts that people who have been infected with COVID-19 might react differently when they're vaccinated than other folks who maybe did not. I never received a positive COVID-19 diagnosis in the past year. When I got vaccinated the first shot, I was fine. Second shot, I was a little sluggish, but you hear the opposite. Anything to say, any correlation between getting the shot and the odds that you might feel a reaction?
Yeah. So when you get COVID-19 infection, it's not COVID-19 that makes you feel sick. It's not COVID-19 that gives you a fever or makes you tired or nauseous. It's your body's reaction to COVID-19. So it's your own immune system flaring up, releasing cytokines and interleukins to try to fight it off, and which it does, very successful, but our human bodies aren't perfect. And sometimes that reaction actually is worse than the actual damage from the infection. So COVID-19, all those symptoms you feel is your body's immune response. So when you get the vaccine, what are we trying to do? Induce an immune response so that you create an immunity against it. So it's not the vaccine that's causing the problem. You're not getting COVID from it. It's your own immune system causing symptoms. That's why a lot of people say, oh, I got the flu from the flu vaccine. You didn't. You had flu symptoms because your body was reacting to that vaccine, similar to how your body reacts to flu, but you didn't get the flu. And it's the same thing here. So if you've had COVID-19 in the past, you've built up some immune system, right? So only when you get the first shot, your body's already knows it. So as a quick reaction, okay, I'm going to attack you because I think you're a virus, but it's really a vaccine. And then actually second shot isn't any worse. And sometimes people have had COVID and then got the first shot, felt sick. The second shot actually isn't as bad as the first one. Now, if you've never had COVID, you get the first shot, you're like, I feel great. Why? Because your body never had a memory or immune system to it. So it's just starting to develop it. And then when you get the second shot, your body's had an immune reaction and now it reacts and you're just feeling that reaction of your body beefing up the immune system even more.
So here's $1 million question. And really it's the essence of why we're here today. What are some ways to address the individuals that are refusing to test, they're refusing to quarantine, they don't want to wear the mask, and they refuse to believe that they can get sick, but they're symptomatic?
Are they a good friend or a stranger? It's gonna change. If it's my brother, I'm gonna punch him in the arm.
I think in this context, it might even be somebody it's in a program that we're serving. You know, they're showing up at the door saying, "I'm here to participate in class today. What do you do?"
Yeah, and we've had this issue in healthcare. People showing up, and it's my right to not wear a mask. And what we say is, is for the safety for all other ones, including your loved one who is here. You're visiting someone. We're trying to keep them safe as well. In addition, I said, listen, you want to go see the doctor. They're the patient. They want to see the doctor, want a mask. You're putting the physician at risk who's trying to help you. So can you help keep them safe and healthy, just like they're trying to keep you safe and healthy? That's what we're saying in healthcare. When it goes outside the setting, neither one of those really work too well. And what we've been telling people is put it in terms of the goodwill that people have. Everyone has goodwill. And listen, for the benefit of everyone else in here, the 1,000 people, 2,000 people, you don't know if they're immunocompromised. You don't know if they have children at home. You don't know if they're taking care of an elderly parent. You don't. So let's not risk them getting sick and maybe even causing death in someone else who is immunocompromised. So you almost play in the heartstrings. To listen, when I'm not mandating you to wear, I'm just mandating that you shouldn't be around these others for the benefit of them. You kind of take it away from them and put it on to the benefit of others.
On a more personal level.
Yes.
But I think we got through all the questions that were submitted and in our chat. We got a few more minutes here. Just what's on the horizon for us? What didn't we cover today that you feel it's important for us to know as folks out in the community, maybe not in healthcare, working with people on a day-to-day, people who really do benefit from that human interaction, especially the population served by boards of DD, us at Easterseals, they really rely on that human interaction as part of their treatment and therapy and being part of the community. What do we need to know going forward?
I can't stress enough the need to get vaccinated, the safety of vaccines, and to listen to data and put the data in perspective and not necessarily listen to everything that the media is saying. Media is born on grabbing people's attention, and they do it very effectively. Even if the media is giving out numbers, we still have to put it in perspective, right? So 6 people got a blood clot out of 75 million. Well, let's put that in a number. 0.0001 versus smoking is 0.2. And so use data, put it in perspective, ask questions, and just be knowledgeable. What I will say, Michael, is I've done several of these, kind of Q&As, interviews. These questions were the best I've had overall out of any of them. And so well done.
Well, that is a credit.
$1 million questions. I'm up to about 11 to 12 million here.
Well, that is a credit to the people who signed up to participate. I think that they're curious. They had great questions. Thank you to everybody who submitted those in the chat. Dr. Joseph, thank you to you for giving us this time today, and really just hats off to everybody at TriHealth and in the medical community There's so many people, unsung heroes, from your environmental services staff that keep the facilities clean, central processing, transportation, surgery, you name it, medical assistants, doctors, nurses. There is a gamut of people behind the scenes that really, just for the past 18 months, you guys have been doing a lot of heavy lifting to keep us safe, to keep the community safe, and to keep us informed. So thank you for that. If people do have questions or they want to learn more about they're ready to sign up for a shot, I think they can go to testandprotectcincy.com and get more information there. There are clinics open. The vaccine is now in plentiful supply. There is no reason to not get a vaccination right now. If you have a transportation barrier, the United Way is making it easy for you. 211, they will get you to and from vaccine clinic. So check those out. Again, everybody, I know we're eager to get back into services this summer. We've got summer camps coming up this summer that we're eager to get people back into safely. We've got other programs coming up and running. So hopefully we can do that safely. And Dr. Joseph, thank you again for sharing this time with us.
My great pleasure. Thank you for having me.